the Region 1 Medical Center, Department of Family and Community Medicine Training Program was established in light of the current trends, patterns, and healthcare needs of the region's population. Dr. Aurora C. Rosario Espinosa and Dr. Ana Melody Madonna Evangelista Monzon were assigned to pioneer respectively as the first chairperson and training officer of the residency training program. The department was envisioned to be responsible for training future family physicians who would be experts in primary care services, able to facilitate the needs for comprehensive care through effective and proper collaboration with other services and specialties. The program started in 2015 with 1 trainee, and thereafter was subsequently followed by 3 resident trainees. At present, the department is comprised of 8 consultants and 21 residents, headed by Dr. Guadalupe S. Visperas Songkuan, assisted by Dr. Mary Ann T. Balatero. The department is tasked to provide efficient, affordable, and accessible primary healthcare services to clients from different parts of Northern Luzon.
The department's mission and vision is geared towards achieving optimum patient care through the delivery of comprehensive, patient-centered, family-focused, evidence-based, and holistic primary care, all to meet the goals of the Universal Health Care Act by the year 2023. Family physicians are trained and expected to develop the following core values. Over the span of 6 years, the department produced 6 diplomates and 2 certified family physicians and continues to train future family physicians committed to the delivery of quality healthcare services.
The Family Medicine Training Program has been designed to expose our residents to the different departments and various specialty practices in the hospital and community setting. This allows our residents to acquire sufficient experience to develop competencies that enable them to practice and demonstrate how 6 Diamond Family Physicians provide the best care for their patients, their families, and their community. We ensure that our trainees go through the necessary rotations in several specialties to gain theoretical knowledge and develop procedural skills, enabling them to diagnose and address their patients' concerns in a holistic approach.
Our trainees are assigned to outpatient rotations in the different specialties and clinics in our institution. We have the different specialty clinics on internal medicine, pediatrics, dermatology, head and neck surgery, the surgical clinic, the OB/GYN and family planning, diabetes clinic, heart station, acute psychiatric unit, geriatrics clinic, TB dots, and the eye center. In the outpatient setting, they are exposed to a variety of cases across all age groups, with the guidance of clinical consultants in their respective departments. They are trained to assess patients, request for appropriate diagnostic workups, and manage cases with acute and chronic diseases requiring primary and secondary interventions and prevention. We also encourage our residents to read on every case they encounter as much as they can to be self-sufficient in expanding their knowledge and thus empowering them to be prepared for their future practice, where learning is a lifelong process. Our residents are taught on how to utilize evidence-based medicine in appraising journals and applying their findings in clinical practice. In all their rotations, they are also expected to identify familial dysfunctions, ones that may need the intervention of a family physician, and subsequently enroll their patients' families in the department's family case program. Our training program also allows our trainees to be exposed to patients with different personalities and behaviors, consulting for several conditions, including mental health. They are trained on the proper approach for patient conversations and counseling, to conduct an extensive and thorough review of patient histories, and utilize the MSE to observe behaviors, attitudes, and body language. Furthermore, the residents are also exposed to cases related to women's reproductive health, where they provide holistic care and necessary management for women with gynecologic conditions, as well as those in their prenatal, perinatal, and puerperal periods at the OB/GYN clinic, labor and delivery rooms, as well as provide counseling, interventions, and education in the family planning clinic. Diagnostic modalities are an important part of our clinical practice. Hence, our residents are given enough time of exposure in radiology to be taught on how to properly interpret radiologic images, as well as directly observe procedures within the specialty to have an idea on the best imaging modalities to use when requesting for their patients. Ward rotations in internal medicine, pediatrics, as well as other services allow our trainees to directly observe and take on the roles of residents from these departments. Our trainees admit, manage, and discharge their own patients and participate in bedside rounds and discussions, as well as diagnostic and therapeutic procedures for cases requiring higher levels of care. Moreover, our residents facilitate acute care for patients requiring emergency interventions in the ER. Apart from strengthening their clinical skills gained during rotations, their procedural skills for diagnostic and therapeutic purposes are further enhanced by exposure to several areas where they are able to perform outpatient procedures with supervision. They are given hands-on exposure to minor surgical procedures, fine needle aspiration, foreign body extractions. They are also trained to be adept in the use of laryngoscopy, the slit lamps, and different equipments for diagnostic and therapeutics. All the skills and knowledge our trainees gain during their rotations are tested and applied in the community setting, where they conduct consults for a vast number of clients. And here, they are able to practice community-oriented primary care by arriving at a community diagnosis and addressing the problems within the community in collaboration with other healthcare workers in the locality. We also give importance to the wellness of our elderly people and their caregivers. We train our residents to conduct the short geriatric assessment tool and assess their family members using the Caregivers Train Index to propose lifestyle modifications to optimize the health of both patients and the caregivers.
In our family medicine clinic, residents are encouraged to treat and maintain the physical, mental, and social health of patients and their family members using various family assessment and family intervention tools and applying the principles of family practice. Our institution houses a family counseling area where our residents can freely develop their communication skills with their patients and their families under the guidance of their mentors. To sum it up, we ensure that our trainees are more than able to provide the envisioned quality services to their clients, a patient-centered, family-focused, and community-oriented healthcare.
We conduct activities consisting of lectures on family medicine foundation courses, evidence-based medicine, occupational and environmental care, geriatrics, tropical medicine, hospice and palliative medicine, community-oriented primary care, research, and quality assurance. We are regularly conducting presentations of residents' clinical and family cases, family medicine principles, as well as update ourselves with the latest available clinical practice guidelines for common diseases encountered in the clinic to aid the trainees further develop their skills and theoretical knowledge to manage and communicate effectively with their patients.
With the rapid spread of the COVID-19 virus, urgent healthcare measures has been implemented to prevent the congestion of patients in healthcare institutions. The Region 1 Medical Center provided and formulated the online appointment system to lessen the overflow of patients, where the department takes part in the triaging of clients to their appropriate clinics for consult. The institution also launched our telemedicine platform, the IPA Checkup, last May of 2020, to respond to the health needs of patients across the Ilocos region. This gives patients access to the online health consultations at the comfort of their homes with different specialties. the department strengthened our resident skills on interviewing telehealth clients and conducting guided physical examinations to improve the accuracy of their diagnosis. As the department is strongly involved in the fight against highly communicable diseases such as COVID-19, we also formulated an organizational process, setting up a screening area located outside the OPD building and a triage unit where patients are classified as non-COVID, COVID suspect, and a probable COVID. In our screening area, our resident physicians manage and discharge and coordinate COVID-related patients for admission in collaboration with the Hospital Epidemiology Center under my guidance as the institution's OPD triage officer. In addition, our residents also took part in the surveillance and monitoring of clients with mild symptoms during their quarantine period. They also conduct home visits for family members of employees as well as collate data in accomplishing daily surveillance reports for the institution.